Greetings, everyone, and thank you for joining the Technical Assistance webinar for the Healthy Families Community-Based Perinatal Health Initiative, Notice of Funding Opportunity. My name is Sinceri Cobb-Souza, and I'm the Director for the Division of Program Operations with the Office of Minority Health for the U.S. Department of Health and Human Services. I am joined today by my colleagues, Dr. Caleb Colon, the Project Officer in the Office of Minority Health, and Mr. Dwayne Barlow, Branch Chief in the Grants and Acquisitions Division within the Office of the Assistant Secretary for Health for the department. Our presentation slides from today's webinar, along with a list of frequently asked questions, or FAQs, will be posted to the grants.gov webpage. To access the presentation slides and the FAQ document, you will need to go to the Notice of Funding Opportunity or the NOFO webpage on the grants.gov website. To get there, you can search in the grants.gov search browser for the phrase Healthy Families Community-Based Perinatal Health Initiative, or by the NOFO number MP-CPI-23-004. The first result will take you to the NOFO's webpage. You will then navigate to the Related Documents tab for the presentation slides and the FAQ document. Please note, we have reviewed all questions that were sent prior to today's call. Many of your questions will be answered throughout the presentation. You may enter your questions in the chat box during today's webinar. Also, to ensure fairness, questions received via email and in today's chat will be grouped by category and answered in the Frequently Asked Questions document on the grants.gov website. At this time, I will turn it over to my colleague, Dr. Caleb Colon.
Thank you, Sinceri, and hello, everyone. Like Sinceri said, my name is Dr. Caleb Colon. I'm a public health analyst and a project officer for the Office of Minority Health. We are pleased to announce the funding opportunity for the Healthy Families Community-Based Perinatal Health Initiative. Next slide. Today's technical assistant webinar will cover an overview of the Notice of Funding Opportunity, the competitive application requirements, and a question and answer session. Next slide. Please be informed that the Notice of Funding Opportunity is available to provide you with essential information and guidance regarding applications. It is highly recommended that you read the entire funding announcement and follow the NOFO carefully. Please note that the information provided in an NOFO takes precedence over any conflict details in other documents. Next slide. This initiative aims to create new ways of incorporating community-based maternal support services into perinatal care system. By developing innovative models, the initiative hopes to enhance the health outcomes of pregnant and postpartum individuals while also reducing racial and ethnic inequalities. Next slide. Community-based maternal support services, or COMS, are social and supported services that aim to tackle social determinants of health that affects individuals. This includes health literacy, cultural and linguistic diversity, exposure to trauma, housing, food, and transportation. Trained professionals like doulas and community health workers provide these services during and after pregnancy, labor, and delivery. Next slide. So let's discuss the expectation of this initiative. The recipient of the award will be responsible for establishing and implementing a community-based maternal support service integration model to enhance communication within the healthcare industry. This project should provide equal opportunities for all providers and community members to contribute to the development and execution of this initiative model, while also addressing the communication needs of pregnant and postpartum individuals and infants. It is essential to keep in mind that medical service expenses are unallowable under this funding opportunity. Next slide. To support the integration of the community-based maternal support services, it is important to establish a collaborative partnership. This partnership includes organizations from different categories, such as community-based organizations or CBOs that provide social and supportive services for addressing social determinants of health, community-based organizations with experience in case management coordination and physical and mental health promotion for high-risk population, and medical organizations such as safety net providers, teaching hospitals, or other medical providers. Next slide. To improve the community-based maternal support services integration model, we recommend incorporating measures from Healthy People 2030 and other resources related to pregnancy, childbirth, and maternal mental health. This includes measures MICH-04 to reduce maternal death, MICH-06 to reduce cesarean birth among low-risk women, MICH-02 to lower infant mortality rates, MICH-07 to reduce preterm birth, MICH-08 to increase early and adequate prenatal care, MICH-D01 to increase postpartum depression screening, MICH-09 to promote abstinence from alcohol during pregnancy, and MICH-11 to encourage abstinence from illicit drugs during pregnancy. It is strongly encouraged that recipients take these measures into account. Next slide. To demonstrate the effectiveness of the innovative perinatal health system that integrates COMS with perinatal medical services, recipients should implement a process and outcomes evaluation. This includes identifying and collecting data on outcome measures such as accessing the impact of the perinatal health system on social determinants of health in areas like health literacy, pregnancy, childbirth, parenting education, cultural and linguistic diversity, and exposure to trauma. Next slide. Another of our expectation is for project recipients to document and share their findings and results, including best practice, lesson learned, process success, and challenges. This information should be disseminated to the population being served, the general public, and other parties interested in the project's outcome. Any publications should include a description of the community-based maternal support services integration model and its impact on maternal and infant health outcomes, as well as any health disparities within the project's geographic area. Next slide. As part of this initiative, recipient must create a disparity impact statement, DIS, that use local data to identify the population most at risk for health disparities. This should be done during the project period. Next. Now we are going to transition to the application content. Next. The content of the application include the project narrative, budget narrative, and appendices. So let's focus on the project narrative content now. To ensure a comprehensive project narrative, we suggest including these components. Next. The first component is the statement of need, where you will need to explain how your project will address gaps in the perinatal care, especially improving access to culturally and linguistically appropriate services for pregnant and postpartum individuals. Focus on underserved populations, including racial and ethnic minorities and limited English proficiency individuals, and how your intervention will incorporate the national standard for culturally and linguistically appropriate services, NCLAS. Next. Related to the project plan, we expect you to outline a specific, measurable, achievable, realistic, time-bounding, inclusive, and equitable goals and objectives for your project. Use MARTI. Connect them to your project approach and work plan. Identify measurable outcomes that demonstrate the impact of your intervention on participants. Envision how your project will benefit the field of the health system analysis, health policy research, health disparities, evidence-based policies, and interventions for underserved populations. Next. In the proposed approach, please provide a plan for integrating community-based maternal support services into a perinatal system of care. Detail the activities and rationale for the approach, including expected outcome and potential barriers. Identify existing partnerships and their contribution, and address any anticipated barriers and how you will be overcome those. Next. In the work plan, please describe what you plan to do to achieve your project goals. We provide a suggested work plan template for reference. Make sure your activities are relevant to your SMART goals and objectives. Also explain how you will keep track of your progress and describe how you work with existing and new partnerships to achieve your goal. Next. You will need to provide a plan for evaluating your project success and assessing the impact of your activities. This includes a logic model, baseline data, measurable targets, and tools for measuring outcomes and lessons learned. Please outline methods for measuring change and monitoring project outcomes, and identify individuals or organizations responsible for evaluation and ensure evaluator independence. Next. Describe your organization's ability and readiness for implementing the project and demonstrating its impact. Please include an organizational chart and describe the roles and responsibility of key personnel and partners, and provide information on your skills and experience informing and managing partnerships for health-related projects, as well as any contractors or consultants involved. Next slide. How will you share your project results with the public and interested parties? Please consider innovative methods and traditional ones like publishing articles. Explain how your findings can inform practice, service delivery, program development, and policy making. Share your model for integrating community-based maternal support services into perinatal care and its impact on maternal and infant health outcomes. Remember that relevant findings and products may be posted on the HHS OMH sponsor website. Next slide. Now we are going to transition to the application review information. We evaluate applicants based on their ability to demonstrate the need for their project through data about the targeted population. Impact on underserved communities and adherence to appropriate standards are also considered. Next slide. We evaluate proposals for integrating community-based maternal support services into perinatal care based on well-defined goals and measurable outcomes. Remember SMARTY, objectives and expected outcomes with partnerships. Next slide. We evaluate applicants based on their clear and well-supported plan, partnerships with public, private, and community organizations, and use of local data to identify health disparities among minority women. Next. We will consider clarity of proposal, major tasks, leverage of existing collaboration, progress monitoring, and task completion in accessing the applicant's innovative model for integrating community-based maternal support services into a perinatal system of care. Next. The evaluation plan should describe how project outcomes will be measured and reported using both quantitative and qualitative tools. It should analyze the project goals and objectives and monitor access and availability to community-based maternal support services. The plan should collect data using reliable measures, including the Healthy People 2030 resources and methodologies. We evaluate applicants based on their capacity, experience, and expertise to complete project activities within the given time frame. We also examine the experience and expertise of key personnel, including evidence of their work with innovative models to improve outcomes for pregnant and postpartum individuals. Additionally, we evaluate your ability to engage partners and successfully execute the project. The applicant should effectively share the impact of the COMS integration model on maternal and infant health outcomes. The dissemination should be timely, catering to the population served and the general public. The applicant should have a feasible plan to publish project findings and procedures articles with comparative data on outcome measures. A detailed description of the model's impact on maternal and infant health outcomes and disparity should also be included. The budget proposal should effectively support the proposed activity and show how total request amount was determined. It should be detailed, reasonable, cost efficient, and aligned with the proposed approach. Next, we'll talk about the budget and application submission and review procedures for the cooperative agreement. I will hand the presentation over to Mr. Dwayne Barlow from the Office of Grants and Acquisition Management. Dwayne, the floor is yours.
Thank you very much, Caleb. Good afternoon, everyone. My name is Dwayne Barlow, and at this point, we're going to discuss the application process. So as you see here in submission dates and times, the application is due by 6 p.m. Eastern Time on July 18th, 2023. Your submission time will be determined by the date and timestamp provided by grants.gov when you complete your submission. You're strongly encouraged to submit your application a minimum of 3 to 5 days prior to the application closing date. Grants.gov may take up to 48 hours to notify you of a successful submission. If you fail to submit your application by the due date and time, we will not review it and it will receive no further consideration. Next slide, please. So as for eligible applicants, any public, private, profit, or nonprofit entity located in a state, which includes one of the 50 United States, the District of Columbia, the Commonwealth of Puerto Rico, the U.S. Virgin Islands, the Commonwealth of the Northern Mariana Islands, American Samoa, Guam, the Republic of Palau, the Federated States of Micronesia, and the Republic of the Marshall Islands is eligible to apply for an award under this announcement. Private, nonprofit institutions of higher education are eligible to apply. Next slide, please. Faith-based organizations and American Indian, Alaskan, Native American organizations that are public or private entities are eligible to apply. Public or private community-based organizations are eligible to apply. Public or nonprofit community-based organizations, CBOs, are eligible to apply. Next slide, please. On this slide, you'll see an example of the eligible applicants. We have state governments, county governments, city or township governments, special district governments, independent school districts, public and state-controlled institutions of higher education, Native American tribal governments that are federally recognized, public housing authorities and Indian housing authorities, Native American tribal organizations other than federally recognized tribal governments, nonprofits having a 501c3 status with the IRS other than institutions of higher education, and nonprofits without 501c3 status with the IRS other than institutions of higher education. Next slide, please. Cost sharing or matching. So you're not required to provide cost sharing or matching in your proposed budget. Now, if you voluntarily include cost sharing in your application, you must include in your budget narrative a non-federal sources justification. During the merit review of an application, cost sharing will only be considered in the overall review of the adequacy of the total proposed budget, federal and non-federal share, to support the project proposed. Applications including voluntary cost sharing or matching that result in an award will include the cost sharing or matching commitment on the notice of award at the level proposed in your application. Any change in that commitment will require prior approval of the grants management officer. Next slide, please. The notice of funding opportunity, or the NOFO announcement. The notice of funding opportunity provides information and guidance to related to applications. So please read the entire funding announcement. Follow the NOFO carefully. And keep in mind that the information provided in the NOFO takes precedence over any conflicting information in any other documents, including this presentation. Next slide, please. The address to request the application package. So you can obtain an application package electronically by accessing grants.gov at the blue URL that you see on the screen. You can find it by searching the assistance listing, formerly the CFDA number found on page 1 of the NOFO. The assistance listing, or the CFDA number, is 93.137. Please be sure to subscribe to the announcement in grants.gov so you receive notification of any updates to the NOFO or any supporting documents. Next slide, please. Application submission. So OASH requires that all applications be submitted electronically via grants.gov unless an exemption has been granted by the grants management officer. If you submit an application via any other electronic communication, it will not be accepted for review. Keep in mind that grants.gov is a website portal. All funding opportunities and grant application packages are made available on www.grants.gov. An application will not be considered valid until all application components are entered in grants.gov and received by OASH Grants and Acquisitions Management Division according to the deadline specified in the date section of the NOFO. Contact grants.gov if you have any questions or concerns regarding the electronic application package. And you can also use the number below, which is 1-800-518-4726. Next slide, please. Applications must be submitted in 3 files. So the first file has to be an entire project narrative. Second file is the entire budget narrative, including supporting documentation described in the budget narrative content section. And file 3 has to have all documents in the appendices uploaded in the attachment section of your grants.gov application. Keep in mind that required standard forms do not apply toward your page count limitations in the submission requirements as stated in the disqualification criteria. Next slide, please. Any files uploaded or attached to the grants.gov application must be of the following file formats. So you can use Microsoft Word, PowerPoint, Adobe PDF, or any of the following image formats. So you can use JPEG, GIF, TIFF, or BMP only. Microsoft Excel files will not be accepted. HHS OASH strongly recommends that electronic applications be uploaded as Adobe PDF. If you convert to PDF prior to your submission, you can prevent any unintentional formatting that might occur with the submission of an editable document. Check the page count of your PDF and/or print the file to ensure that the document does not exceed the page limit. Next slide, please. With regard to application submission, remember to be complete and do not leave blanks on forms unless the information is clearly not applicable. The individual submitting the application forms must have the legal authority to act on behalf of the organization. Next slide, please. To ensure successful submission of your application, carefully follow the step-by-step instructions provided at the blue URL that you see on the screen here. These instructions are kept up to date and also provide links to frequently asked questions and other troubleshooting information. Next slide, please. Okay, so what you're seeing on the screen at this time are the application elements in terms of forms. You need an application for federal assistance or SF-424, budget information for non-construction programs or SF-424A, the disclosure of lobbying activities forms or the SFLLL, the project abstract summary. In terms of files, the project narrative, submit all project narrative content as a single acceptable file. For the budget narrative, submit all budget narrative content as a single acceptable file. For appendices, submit all appendix content as a single acceptable file in the attachment section of your grants.gov application. Next slide, please. Project abstract summary. So you must complete the project abstract summary form provided in the application package. The abstract will be used to provide reviewers with an overview of the application and will form the basis for the application summary in the grants management and program summary documents. If your project is funded, HHS will publish the abstract from your form on tags.hhs.gov and usaspending.gov. The abstract may also appear on the program office website or other government websites, so do not include sensitive or proprietary information in your abstract. Next slide, please. So, application format. Remember to Follow the project narrative format instructions in NOFO. Your application will be disqualified if it does not conform to the format requirements. You must double space the project narrative pages. You must use 12-point font. You should use an easily readable typeface such as Times New Roman or Arial. You may single space tables or use alternate fonts, but you must ensure that the tables are easy to read. For appendices and budget narrative, you should use the same formatting specified in the project narrative. Appendix documents such as resumes may use alternate formats common to such documents. Next slide, please. So the UEI number in the System for Award Management, or SAM. To register your organization, you will need a unique identity identifier, or UEI. So on April the 4th, 2022, the federal government completed its transition to the 12-digit UEI number as the required UEI for registration in SAM. You may begin the registration process, including receiving your UEI, at the blue URL that you see on the screen. An entity registration checklist is available at the following blue URL that you see on the screen. You may register in SAM as either an entity applying for federal assistance awards only, in other words, grants or cooperative agreements, or all awards, including procurement awards. Next slide, please. So going deeper into the System for Award Management, or SAM. If you are registering a new entity in SAM.gov, you need to create a login.gov account if you don't already have one. Keep in mind that the minimum time frame to complete an initial SAM registration online is 30 minutes. The time frame for applicants' registration to become active is up to 10 days and may take longer depending on volume, or if the SAM system flags the information you provide for manual validation. Average time frame for updates in SAM.gov updates in SAM.gov to appear in grants.gov is up to 72 hours. If you plan to apply for this funding opportunity, or you think you might apply, you should ensure your organization's registration is active in SAM well before the application deadline and will be active through the competitive review period. Next slide, please. The SAM registration must be renewed each year. If you're renewing your registration, your old SAM.gov username and password may not work anymore. You'll need to create a login.gov account if you don't already have one. Next slide, please. We strongly recommend that applicants check for an active registration in SAM well before the application deadline. If you are successful and you receive an award, you must maintain an active SAM registration with current information at all times during the active award. If you have not complied with the SAM registration requirements, HHS.gov may determine that you're not qualified to receive an award and may use that determination as a basis for making an award to another applicant. Should you successfully compete and receive an award, all first-tier sub-award recipients must have an UEI number at the time that you, the recipient, make a sub-award. Next slide, please. Funding restrictions. So if you are successful and you receive an award, by accepting the award, you agree that the award and any activities thereunder are subject to all provisions of 45 CFR Part 75 currently in effect or implemented during the period of the award, other department regulations and policies in effect at the time of the award, and any applicable statutory provisions. Keep in mind that your costs must be allowable, allocable, reasonable, and necessary direct expenses or indirect costs in accordance with regulations and current policy. Indirect costs may be included per 45 CFR.414. Applicants should indicate which method or rate is used for this application. Keep in mind that pre-award costs are not allowed. The current salary limitation is $212,100 effective January 2023. Next slide, please. Budget narrative and forms, Keep in mind that they must be consistent with the requirements of the NOFO. Budgeted costs must reflect proposed activities. Budget line item descriptions and justification requirements are explained in the NOFO. Suggested table formats are in the NOFO. Plan for oversight of federal award funds. Keep in mind that you need to have that. And also keep in mind that forms, budget narrative, and detailed justifications do not count toward page limit. Next slide, please. Budget narrative and forms, tips for development. So you must develop an itemized budget using Section B, Box 6 of the SF 424 for the first year of the proposed project. For awards with an anticipated period of performance of 1 year or less, this will be the budget request for the entire project. Provide a budget justification, which includes explanatory text and in line item detail for the entire first year of the proposed project. The budget narrative should describe how the categorical costs, for example, salary, equipment, supplies, and consulting costs, are derived. Discuss the necessity, reasonableness, and allocation of these proposed costs. Next slide, please. For subsequent budget years in an anticipated multi-year project, provide a summary narrative and line item budget for each year beyond the first. For categories or items that differ significantly from the first budget year, provide a detailed justification explaining these changes. Do not include costs beyond the first budget period in Box 6 of the SF 424A or Box 18 of the SF 424. The amounts entered in these sections should only reflect the first budget period. Next slide, please. Okay, so indirect cost methods are described in 45 CFR 75-414. This category has one of two methods that you can select. You may only select one, and you must clearly identify that selection in your submitted budget. If your organization currently has an indirect cost rate approved by the Department of Health and Human Services or another cognizant federal agency, you should enclose a copy of the current approved rate agreement in your budget narrative file. For the applicant that has never received a negotiated indirect cost rate, you may elect to charge a de minimis rate of 10% of modified total direct costs, which may be used indefinitely. If chosen, this methodology must be used consistently for all federal awards until such time as an applicant chooses to negotiate for a rate. Next slide, please. If your proposed budget requests a rate that is less than allowed, your authorized representative must submit a signed acknowledgement that the organization is accepting a lower rate than allowed. To obtain a negotiated indirect cost rate with the federal government, you may contact the U.S. Department of Health and Human Services Cost Allocation Services Regional Office that is applicable to your state. The CAS regional contact information is available at the URL that you see on the screen here. In this case, it's in black. Next slide, please. Application disqualification criteria. If your application does not meet the following requirements, it will be disqualified and receive no further consideration. So it has to be submitted electronically via grants.gov by the due date and time, unless an exemption was granted 2 business days prior to the deadline. If you successfully submit multiple applications for the same project, we will only review the last application received by the deadline. Keep in mind that HHS.gov needs to deem your application as eligible. You must complete the required forms in the application package, that is the SF424, the SF424A, the SFLLL, and the project abstract summary. Also keep in mind that your application must be submitted in the English language and must be in terms of US dollars. Next slide, please. If your application does not meet the following requirements, it will be disqualified and you will receive no further consideration. This is super important. The Project narrative must be double spaced on the equivalent of 8.5 by 11 page size with 1-inch margins on all sides. Font size must not be less than 12 points. Your project narrative must not exceed 30 pages. The total application, including project narrative, must not exceed 50 pages. Next slide, please. Keep in mind that your federal funds requests, including indirect costs, should not exceed the maximum indicated in the award ceiling per budget period, which in this case is $1,250,000. Keep in mind again that your federal funds requests, including indirect costs, must not be below the minimum indicated in the award floor, which is $975,000. If you have included voluntary cost sharing or matching, you must include in your budget narrative a non-federal sources justification. And keep in mind again that your application must meet any application responsiveness criteria under Section C3, other application responsiveness criteria. Next slide, please. I need to add here, though, that there are no other application responsiveness criteria in Section C3. Next slide, please. Applications that lack the required supporting documentations or submit additional appendix files will not be disqualified from competitive review. However, this may impact your application scoring under the evaluation criteria. So please be sure to follow the submission instructions carefully as stated in the NOFO. Next slide, please. Okay, so as far as your application review criteria, I just broke down here the points that you receive per section. So statement of need, 10 points. Project plan, goals and objectives, 10 points. Project plan, proposed approach, 15 points. Project plan, work plan, 15 points. Evaluation plan, 20 points. Organizational capability, 15 points. The dissemination plan receives 10 points. And budget reasonableness receives 5 points. Next slide, please. Okay, application merit review. So eligible applications will be reviewed and assessed by a panel of independent reviewers with technical expertise in applicable fields according to the criteria listed in NOFO. The merit review process is formal and confidential. Federal staff are available to answer questions and to ensure that the process is consistent and fair, but do not participate in discussion and assessment of the application. At that point, applications are reviewed first by GAM staff for administrative and business compliance, and secondly by OMH program office staff for programmatic compliance. Next slide, please. Funding decisions. So, the Deputy Assistant Secretary for Minority Health will make final award selections to be recommended to the Grants Management Officer for risk analysis. In providing these recommendations, the Deputy Assistant Secretary of Minority Health will take into consideration the following additional factors: equitable geographic distribution of projects. Next slide, please. Upon completion of risk analysis and concurrence of the Grants Management Officer, HHOS will then issue notices of awards. No award decision is final until a notice of award is issued. All award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. We're not obligated to make any federal award as a result of this announcement. Keep in mind too that only the Grants Management Officer, or GMO, can bind the federal government to the expenditure of funds. If you receive communications to negotiate an award or request additional information or other clarifying information, this doesn't mean that you'll receive an award. It only means that your application is still under consideration. All award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. So, HHS-OH will evaluate each application in the fundable range for risk posed by the applicant before issuing an award in accordance with 45 CFR 75.205. OASH will use a risk-based approach and may consider any items such as the following stated in the NOFO. So we'll take a look at the applicant's financial stability, quality of management systems, and the ability for the management to meet the standards prescribed in 45 CFR Part 75. We'll take a look at your history of performance, reports and findings from audits performed, and the applicant's ability to effectively implement statutory and or regulatory and departmental policies and procedures. Next slide, please. Your plan for oversight of federal award funds. Keep in mind that if your internal controls are available online, you may provide the link as part of your plan in the budget narrative. We've also included supplementary material, section I-2, which contains questions applicants may find useful in considering their plan for oversight of federal funds. Next slide, please. Non-funded application as a result of risk review. If we determine that your organization does not meet either or both of the minimum qualification standards as described in 45 CFR 75-205A2, and we do not make an award to you as a result, we must report that determination to FAPIS if certain conditions apply. Keep in mind that the information reported in FAPIS is available for other organizations to review when considering you for an award. Next slide, please. The notice of award. First of all, it notifies the successful applicant of the selection, the award amount, and the project and budget periods. It includes any conditions on the award, in other words, requirements that must be met as a condition of receiving the grant funds. And it includes standard terms and conditions, reporting requirements, and contact information for OASH-GAM and the program office. Next slide, please. Points of contact. GAM is the official contact for awardees throughout the award lifecycle. All official communication related to the award is between GAM and the successful applicant. Unsuccessful applicants will be notified by the program office via letter. Next slide, please. So here's a summary, and tips. So for your project narrative description, you want to be clear, complete, concise in the project description. Follow and address exactly what is requested in the NOFO. Don't make the reviewer search for the required information. Generally, the easier the application is to review, the better the rating or the score. You also want to keep in mind that reviewers are not allowed to do external research or follow embedded links, etc. Clearly identify the sections of the applications and indicate which component is being addressed. The project narrative must include all required information within the page limit. Do not use appendices to expand the page limit. Next slide, please. The project narrative description a little bit more. You want to make sure that the goals and objectives for your project are SMARTY, as stated earlier in the presentation. So they're to be specific, measurable, achievable, relevant, time-bound, inclusive, and equitable. Activities presented in the work plan should relate directly to the proposed goals and objectives. Program work plan, evaluation plan, and budget should provide a complete picture of how the applicant will address the needs as well as address the purpose and expectations as described in the NOFO. Next slide, please. Staffing. The staffing for the project should be appropriate and reasonable for the goals, objectives, and activities of the proposed project. Please be complete in describing what staff will do, the expertise required, and the percent time they will be assigned to the project. Next slide, please. The budget. The budget should include adequate funds to carry out the proposed work plan, evaluation plan, and administrative responsibilities of the project. The budget should be reasonable and relate directly to the goals and objectives of the project. Please don't request more funds than are available as listed in the NOFO. This amount is inclusive of indirect costs. The operating budget should be complete and include federal and non-federal funds, projected program income, and examples of those would be fees and third-party payers, and other contributing funds. Next slide, please. So overall, please include full names, first, middle, and last for authorized officials, principal investigators, project directors, and all essential personnel. Keep in mind the electronic submission is required. Don't wait until the last minute to begin SAM registration or update your registration. And please don't wait until the last minute to begin the electronic submission process. Problems could arise. Next slide, please. So if you have specific questions and you want to make inquiries for program questions, you can reach out to Mr. Rodriguez. His email is listed here on the slide, as well as his telephone number. If you have administrative or financial questions, you can reach out to me. And as stated above, my email and telephone number is also listed on this slide. If you have electronic submission requirement, for electronic submission requirements, so if you need any grants.gov applicant support, then you can go to grants.gov, or you can email their support group at support@grants.gov, or you can use the telephone number that you see on the screen, 1-800-518-4726. Keep in mind that you should not contact OASH program or grants office staff for grants.gov issues. We don't manage that site. So if you're having technical difficulties, you want to reach out to their help desk and they'll be happy to help you. When I say they, I'm referring to grants.gov help desk. Next slide, please. So at this point, I would like to thank you for your attention and your time, and I want to turn it back over to Caleb.
Thank you, Dwayne. Now our division director, Susiri Kopsusa, will lead the question and answer session.
Great, thank you. Thank you for your presentations. So we'll begin questions to the category under eligibility. This first question is either for Caleb or Dwayne. What applicants are eligible for this NOFO, and how will they be defined for this funding opportunity?
I can take that question. So as we stated before, any public or private nonprofit entity located in a state, which includes the 50 United States, the District of Columbia, the Commonwealth of Puerto Rico, U.S. Virgin Islands, the Commonwealth of Mariana Islands, American Samoa, Guam, the Republic of Palau, the Federated States of Micronesia, and the Republic of the Marshall Islands is eligible to apply. We also want to include that private nonprofit institutions of higher education are eligible to apply. Faith-based organizations and American Indian, Alaskan Native, Native American organizations that are public or non-profit private entities are eligible to apply. We also want to include public or non-profit community-based organizations, CBOs, are eligible to apply. And examples of eligible organizations can be found in the NOFO on pages 9 through 10.
And just to clarify, Dwayne, are for-profit entities eligible to apply?
No.
Okay, thank you. Next question is for Dwayne. Who will determine or who will decide eligibility?
The Grants and Acquisitions Management Division will evaluate, in accordance with 45 CFR 75205, each application recommended for funding by the program official indicated in the review and selection process for risks before issuing an award.
Okay, next question is concerning the deadline. Dwayne, if you would restate, what is the deadline for submitting an application in response to this funding opportunity?
Okay, so applications are due July 18th, 2023 by 6 p.m. Eastern Time. And keep in mind, to receive consideration, you must submit your application electronically via grants.gov no later than this due date and time.
Okay, next question. Who should I contact if I still have questions about this NOFO or questions about developing my application? Program questions, Questions concerning the budget. Who are the points of contact?
With regard to program questions, you want to reach out to Mr. Paul Rodriguez. And as I stated before, in a couple of slides back, his email and his phone number is listed in this presentation that you'll have access to. And if you have administrative or financial questions, you can reach out to me. And again, my email and phone number, they're listed in the presentation as well.
Okay, so to ensure that prospective applicants are aware of the registrations required to apply for this funding opportunity, if you would, Dwayne, if you would restate, what are the registrations that are needed to apply for this NOFO?
Well, the registrations that you would need to apply for is you need a UEI, and you would and that particular registration that you would need goes hand in hand with SAM, your SAM registration, and you go to sam.gov, and that is the website that you would go to receive the proper registration.
Great. What do I do if my registration has expired? My SAM registration?
You're going to have to renew your SAM registration. And as we said before, you're going to have to go into the system, keeping in mind that you're going to have to make sure that your login.gov account is set up, or that you can, or you may have to reestablish that. But that is what you'd have to do if you wanted to renew.
Great. Next question is for Caleb. If you would, can you explain the page limits for submission of competitive applications? I know the information was covered on your slide, but if you would, can you explain the page limits?
Yes, of course. So and the page limits are, sorry. Yep, all right. The project narrative is limited to 30 pages and do not include your project abstract summary. And since your project narrative plus appendices cannot exceed 50 pages, that leaves 20 pages for your appendices. The appendices should include items below, and it's described in the NOFO, like work plan, logic model, project population focus, memorandums of agreement, organizational charts, CVs or resumes, and reference items.
Okay. Next question. Are applicants required to submit their memorandums of agreement or MOAs and letters of commitment with a competitive application? Caleb.
Yes, if available at the time of submission, signed MOAs or signed LLCs may be submitted for each partner, and it should include specific roles, responsibilities, resources, and contribution of partners to the project.
Okay. Next question is for Dwayne or Caleb. Please confirm the following: the award amounts for this NOFO, and clarify the budget period and the estimated period of performance. There's a section in the NOFO on page 10. So again, if you would, confirm the award amounts, clarify the budget period, and the estimated period of performance. And I believe that's in the NOFO on page 10, the section pertaining to the award ceiling and floor.
So the award ceiling is $1,250,000, and the award floor is $975,000. So let me just say that again. The award ceiling is $1,250,000. The award floor is $975,000.
And what is the budget period for those awards? So I'm asking the question to clarify because there are several questions in the chat. The award amount that was noted on the slide, for example, the ceiling of $1,250,000, is that for a 12-month period, or is that for the period of performance, which is not to exceed 4 years?
That is for a 12-month period.
Great, thank you. Next question. Are applicants required to submit detailed budgets for sub-awardees or sub-recipients as part of the application?
Yes.
Yeah, okay, yes, okay. Next question is pertaining to the application review. This question is specific to the budget. Are budgets scored as part of the review process?
Yes.
Okay. Can we appeal if we are not selected for an award?
No.
Next question. What is the purpose of this initiative? What are the expectations for OMH for this initiative? And so this is a program question, goes to Caleb.
Yes. So the purpose of this initiative is to it's intended to develop innovative models for integrating community-based maternal support services into perinatal system of care. The models should include methods for accessing these community-based maternal support services needs for pregnant and postpartum individuals and infants included in the demonstration project. OMH expects that recipients' innovative models will improve pregnant and postpartum people's health outcomes and reduce racial and ethnic disparities.
Are medical service costs allowed under this funding opportunity?
No, they are not allowed.
Okay. Next question. Can we submit multiple applications? So this question is, yeah, okay. If you would elaborate on that, please.
Yes, you can submit multiple applications from the same organization and for the same project, but we will only review the last application received by the deadline.
Okay, next question. Are we supposed to address all of the bullets related to the expectations? This is a program question, goes to Caleb.
Yes, we expect that you address all the bullets.
Okay. Next question. The NOFO, I've noticed, includes the disparity impact statement, or a DIS. What is the purpose of the disparity impact statement, or the DIS? This is a program question for Caleb.
The disparity impact statements are part of a comprehensive data-driven approach for identifying and addressing health disparities to promote health equity for racial and ethnic minority populations. The DIS refers to the demographic, cultural, and linguistic data to identify the population in which health disparities exist and the quality improvement plan designed to address the noted disparities. So the expectation is that successful recipients are required to develop a disparity impact statement using local data and input to identify population at that highest risk for health, social, economic, and other disparities such as low health literacy.
Okay. Next question. Are we required to incorporate the Healthy People 2030 and other measures in the development of the POMS integration model?
It is strongly encouraged to include Healthy People 2030 measures and resources for pregnancy, childbirth, and maternal mental health.
Okay. Should we conduct a process and an outcomes evaluation?
Yes, we expect recipients to identify and collect data and outcome measures to demonstrate the effectiveness of the innovative perinatal health system that fully integrate the COMS with perinatal medical services.
Okay. Yes.
And this should include measuring accessing the impact for perinatal health system on social determinant of health also.
Next question for program. Are we required to partner with other agencies and organizations?
Yes, we expect recipients collaborative partnerships to support the development, implementation, and evaluation of the integrated comms model within the geographic community of focus.
And the collaborative partnership should include either organizations or activities that cover, are there particular categories, Caleb?
Yes, it could include community-based organizations or CBOs that provide social and supporting services that address social determinant of health. Also CBOs with experience in case management coordination and physical and mental health promotion for high-risk populations, and medical organizations such as safety net providers, teaching hospitals, or other Medicaid providers.
Great. And last question, is it the OMH expectation that successful applicants, that is recipients, would publish or disseminate the findings of their project? Caleb?
Yes, that is correct. We expect recipients to document and share project findings and results. This could include best practice, lesson learned, processes, tests, and challenges with the population served, the general public, and other parties interested in project results.
Okay, thank you. So at this time, we would want to thank our presenters today, Dr. Caleb Pallone and Mr. Dwayne Barlow. Please note, we will upload the frequently asked questions document, the presentation slides, and the recorded technical assistance webinar to the grants.gov NOFO webpage next week. If your questions were not answered today that were entered in the chat, please note that those questions will be incorporated into the final FAQ document with a response that will be posted to the grants.gov site next week. We'd like to thank you all for joining us for the Office of Minority Health's Technical Assistance webinar, and best of luck on your competitive application submissions. Good day.